Plantar fasciitis is an inflammation of the plantar fascia. The plantar fascia is at the bottom of the foot. It lies below the skin. It's a fibrous band that connects the heel to the base of the toes. This fascia can become inflamed for a number of reasons and cause heel pain first thing in the morning. So the first stretch I'm going to show you for plantar fasciitis is pretty simple. You're going to take the affected foot, let's say it's the right side. I'm going to bring my right leg and cross it on my left leg. I'm simply going to take one hand and stabilize my heel, the other hand really at the ball of my foot, and I'm going to pull, okay? I'll really try to get a nice gentle stretch here to stretch out this fascia. Again, the plantar fascia sort of runs at the bottom here, connects the heel to the base of the toes, okay? So we're going to stretch good 30 to 45 seconds or so, and you want to do this a few times a day. Of course, take your doctor's advice, okay? So the second stretch is pretty simple as well. This time you're going to need a towel, and this stretch is great to do before you get out of bed in the morning to try to help with that morning pain. So what you're going to do here is, you see how I'm sort of sitting down? Take the towel and you're going to put it, sort of wrap it around the ball of the foot. Okay, we want to do it like that. And you're just going to stretch sort of the ball of the foot just like this, like a nice gentle stretch, 30 to 45 seconds or so. Nice gentle stretch, and then you can release after that period of time. You can do this multiple times. Obviously, you can do this both feet. If they are both affected, this can be a really great stretch to do. And of course, it's just the towel, so you can do this anywhere. This third stretch is also super easy peasy. You don't actually need Lysol, but you do need something that is cylindrical, and that's why I have this can. You can use a tennis ball, you can use a canned good, you can use a water bottle. This is what I had in the office, so I'm going to show you what you're going to do. You're going to place your cylindrical item on the floor, and you're going to use this to stretch out the plantar fascia. You're literally going to roll the bottom of your foot on top of the ball or the water bottle or whatever you have, and this will give you a nice stretch. So another great stretch to do is to literally outline the alphabet with your feet and your toes to give yourself a nice stretch, A, B, C, D, and just sort of go through the alphabet as a way to get a good stretch. And another stretch, I should say, along these lines is practice picking things up from the floor with your toes. That's right. So I got my sock here. Literally try to grasp this with your feet. This can be a nice stretch as well. You can do this with a towel or whatever you have. Another stretch that you can do is you want to get either a step stool or you want to get a staircase or something like that. The unaffected foot, let's say this is not affected, goes flat. The affected foot with plantar fascia, you just sort of want to drop down off the back of the step or the step up or stairway or what have you, just to get a nice stretch like this. And you can kind of see this is a stretch that you can get. If the other side were affected, it would be this side, okay? But this is just to sort of stretch out. And you can do this 30, 45 seconds and repeat this a few times a day. The final stretch is another one you can do anywhere pretty much. You want to get a wall, two hands against the wall. The affected foot, let's say it's this one, you're actually going to bring back a little bit. Make sure your foot is in alignment and come straight ahead. Bring that back. You want to bend the unaffected foot leg side, and you just want to give yourself a nice stretch like this, okay? Some people also say you can then bend this leg as well for an additional type of stretch. But you can also keep this straight with this leg bent, okay? This stretch will give you, again, a nice stretch for your plantar fasciitis. This would be the affected side. You can switch sides as well. Again, 30 to 45 seconds a few times a day. Hopefully that will help. I hope these stretches are helpful. Remember, you want to make sure you get a proper diagnosis from your doctor about if your symptoms are due to plantar fasciitis or something else. Now, there are plenty of other potential treatments for plantar fasciitis. They include rest, ice, Motrin, Tylenol, also gel heel cups or even orthotics. Sometimes night splints are prescribed for people. Sometimes physical therapy, steroid injections, gel heel cups, if I haven't said them already. Also, you want to make sure you're wearing good shoes with good support, keeping a healthy weight, resting, all of those things can be very helpful with plantar fasciitis. You want to make sure you get that proper diagnosis and get instructions from your doctor. Guys, I'm Dr. Jen Caudle. If you've not liked and followed my page, I invite you to do so. For those of you who send stars, thank you so much. I so appreciate you. I'll respond to you personally. For those of you on YouTube, please subscribe to my channel. Click the little bell for updates. Guys, I'm Dr. Jen. I'll see you soon.